Hello everyone, and welcome to this video from the American Institute of Personal Injury Physicians. This is how many new PI patients a month. If you're watching this video, then you're clearly interested in improving and expanding your personal injury practice. But the question is, how many new PI patients a month can your practice actually handle? I realize there's a lot of organizations and other companies out there that say they can provide you with 15, 20, 30, 80 new PI patients a month. But in reality, how many of those can you actually handle, process, and have the right systems in place? Otherwise, it can become very problematic. Let's take a look. So here's what you need to do is ask yourself, how many PI patients can your practice, or can we realistically handle in our practice? For some, right now, it may only be one or two. For others, it may be more. But it's really important to take a step back before you start adding new PI patients into your practice. Otherwise, you wind up with the leaky bucket syndrome. You have all of these new PI patients come into your office, and before you know it, if you're not prepared, they start to disappear. And a few weeks down the road, you start asking your staff, what happened to Mrs. Jones? What happened to Mr. Smith? Where's this patient? Where's that patient? They dropped out of care. They decided to do something different. If you're not prepared and you don't have the specific PI systems and procedures in place before you start accepting personal injury patients, as quickly as these patients show up, they're going to be gone. And another thing to ask yourself, are you current with the most up-to-date personal injury documentation and management? So go ahead and ask yourself these questions. How many can you realistically handle? Do you have the systems in place, and are you current? And if the answer is not to number 2 and number 3, yes and yes, then I would caution you and take a step back and go ahead and get these in place in your practice, and you'll find yourself being more successful. So here are some considerations to truly avoid what a lot of providers go through, which is frustration and aggravation when it comes to personal injury. Is first, have a really strong financial policy specifically for personal injury. You want to get paid, either from the third-party settlement or from the patient or from a first-party carrier. Take the time to develop out a strong PI financial policy. Next, have a clinical procedures checklist in place. Know exactly what you and other providers in your office are supposed to do every office visit. And that goes right into have an administrative procedures checklist or a staff procedures checklist as well. There should be accountability in your office, and make sure all the steps are in place every single time. Otherwise, it becomes very problematic where you think someone else did the procedure or things fall through the cracks, and then again, you start winding up with a lot of frustration and aggravation. Also, create algorithms. How do you want to process these patients? What decisions do you want to make? Sometimes it's called a decision tree. Develop out PI-specific algorithms. This will make it a whole lot easier when you get into your treatment and management, what should be done and when it should be done. All right, so here are some specific steps. Think about it for just a second. What's your number? What's your goal for the number of PI patients a month? Is it just 1 or 2? Is it 10 or 20? Whatever the case is, that's totally up to you. But get your systems in place to avoid aggravation and frustration. Personal injury moves very fast and things change very quickly on PI cases, so it's very important to get your systems in place. Update your PI skills. Take seminars, webinars for everyone in your office. Make sure everybody is up to date with the most current of personal injury documentation, management. Take as much personal injury as you can. All right, thanks for watching. Please let us know if you have any questions. Feel free to email us at info@aipip.com or at 888-924-7479. Take care, everyone, and we'll see you on another AIPIP video.